Thank you so much for sharing that. And it's just tragic to me that to hear about, for example, the 60+ doctors in Italy who died of COVID, and realizing, we're losing our healthcare workers, nurses, medical staff, physicians, right there on the front lines who very courageously are going to work daily, to face this. And they, of course, also risk bringing it home to their families. So there are tremendous kind of challenging issues to the healthcare professionals. How about how about non-healthcare professionals who are calling you for help? What are you finding to be kind of the main challenges there? And also, how are you offering help in those cases?
Definitely. So probably, and I never ever, did this statistic or calculation before, but probably a quarter of my patients are affiliated with the healthcare system in some way, shape, or form. So a quarter of the people that I speak with now weekly are affected by this, maybe even a third. And they're affected, but they're usually very, very affected. And then there's the rest of us, right? There's the rest of the people who are affected indirectly. I've had a number of patients already either be furloughed or lose their jobs, or be in the position where most likely they will lose their jobs, or who have their jobs, but now because of the quarantine, have 2 children at home, both the mom and dad are at home, and they're in a small New York City apartment, and everybody has to work, and there's no childcare. So this is another situation a lot of people are finding themselves in. How do you homeschool your young children at the same time as having to be productive at work, and to do this without, the crutches such as childcare that you're used to relying upon? And then I have a number of older patients who are socially isolated and alone during this time. And it's a very, very lonely experience and very scary also. They have to be socially isolated because they're at higher risk, but it exacerbates loneliness. And this is one of the most difficult things that people are dealing with right now. It's a loneliness epidemic. There's the fear epidemic. There's obviously COVID. And then there's this loneliness epidemic also ensuing. And then finally, I have a number of patients, this is just the other side of it all, which it's so interesting to me. The ones who are having the most right now suicidal ideations are actually those that aren't experiencing any of those things that I just described, but it's those that are describing themselves as bored. It's like they had a purpose in life, they were moving forward, and suddenly everything stops and they just don't know what to do with themselves. And they're going inside themselves into these dark places. I think everybody else is struggling to survive, struggling to figure out where to from here and how do you make the next move. But there's some people who aren't as in danger, and yet their mental health is all the more affected by this. Mm-hmm. And, during the Holocaust, a lot of people's neuroses, which are those things like not knowing what to do with boredom, those go down because you have real external survival issues to deal with. And it's interesting that right now, the people who are most, in my practice, the ones that are most having greatest suicidal spikes are actually the ones whose neuroses are spiking because their survival risk isn't as great.
Wow. I find that interesting because these are people who maybe find their identity from doing things, right, having things to do, and don't necessarily feel comfortable just being with themselves. And of course, that is something I'm very comfortable with. I love to just be with myself. I think it's interesting because in my family, there's different personalities. Some of us are very content being alone, working on projects, getting things done. My brother's building all of these things in his woodworker shop and redoing the bathroom and such. But my other brother, he is very social. And so he's really missing out on that constant contact with people. And so he's doing a lot of Zoom conversations, trying to stay in touch with everyone. But I think we all kind of handle this differently, and that boredom is fascinating. That is one of the things that my daughter, when she had issues in high school with mental health, it was boredom, she said, that got her into trouble. So how fascinating that now that we're all sitting at home, that some of us really suffer deeply from that boredom. Can you speak more to that at all?
Absolutely, absolutely. And it's like, what comes up in you when you're sitting with boredom, right? Is it anger? Is it fear? Is it terror? Or boredom itself? It's like you said, Karen, it's such a luxury usually that people don't have the chance or the time to do. And now you're forced into this isolation quarantine of just being. And there's many ways you can get around this. You can be social, you can Zoom, you can talk, you can take up new classes, But then some people, especially some people with underlying mental health issues, maybe don't have the motivation, maybe don't have the wherewithal or even the knowledge of how to go forward with that, and say that they go into themselves. And it's, I think, equivalent to somebody really with too much time on their hands who starts to think too much. And usually they use all sorts of escapes in their regular life so they don't have to go inside in that same way. And those escapes could be drugs, alcohol, sex, whatever it is. And here suddenly you don't have any of that. You're just there alone with yourself. And then you see what's there. And some of us, when we look inside for the first time to see what's there, there's darkness. There's a lot of things we have to start to process and to welcome in, and feelings we have to feel that we don't like to feel, that we'd much rather escape from. And so
isn't it interesting then how so many are faced with that now, all at the same time? You know, Eben speaks a lot about addiction, how the addiction to all of those things that you just rattled off are all material things. And you know, Eben often says you can't fill
a spiritual hole with material stuff.
Mm-hmm.
I mean, that's basically what people try and do in any kind of an addiction. Certainly ones that involve substances like alcohol and drugs, but of course other addictions too. You're trying to fill a hole in your soul that really requires spiritual addressing. And for me, that's why, for example, meditation. I mean, I use this downtime of the the lockdown under COVID to meditate. I enjoy having an hour or two a day to use Sacred Acoustics, go deep into the universe. Once you realize your consciousness is not created between your ears, but actually connects you with a very powerful integrative level of this entire universe, it is a worthy field for exploration. So for me, I'm very grateful to have Sacred Acoustics at times like this to explore, because that boredom is truly, it can be a real killer in many ways. So important to have other ways of kind of gaining purchase in this world and satisfaction on a daily basis. And that's something where, for me, meditation's been very helpful.
I love that. And I think it's so, so important. I think Sacred Acoustics at a time like this can help people to elevate, because Sacred Acoustics, it's not just sounds, it's sounds that are programmed in a very special way to help elevate your consciousness, and with all sorts of different motivations, intentions behind them. I think that's so beautiful. What Jesse and I have been doing, we've also, and I'm just so happy to have him home. I'm happy to, have my life partner beside me to be able to do these things. But we have, obviously, I don't have that much free time on my hands because I'm actually seeing more patients now than I usually do. But the time that we do have, we're also trying to explore those spiritual things that we were like, if we had more time, this is what we would do. So most recently, we started doing Merkaba work, creating Merkaba through the work of Maureen St. Germain and Drumdal and Melchizedek. So we've been doing Merkabas every day, and we've just been loving that. And there's so many different things that, I'm like, if I had the time, I'd want to explore this. And I have such a list, I can't even imagine being bored. And so I always try to ask my patients, okay, well, you have this time. First, recognize, relative to what you could be experiencing, your boredom is such a luxury right now. Because let me tell you about a few of my other patients, A, B, C, D, right? And then, what is it that you have always wanted to do that you've never had time for? Some people have so much time, this is actually what Viktor Frankl said. When you have too many things and not enough time, that's a good problem to have. When you have too few things and too much time, that's an existential crisis. Right. So I think that's why these people are finding themselves with boredom in a state of existential crisis. There's not enough passion, there's not enough motivation, not enough will. So we have to look within, and what is it that you want to do? And if you don't have those answers, let's come up with those answers. Let's figure out, what your soul purpose is and why you came into this world. Let's start asking those deeper questions to give you insight into really how you can use this time to open up and take your own life to the next level.
Well, that's beautiful.
I think another important point I'd like to make about this is addiction and alcoholism studies certainly talk about kind of turning it over and going for a higher power. And in many ways, I would say this kind of meditation is finding that in fact that higher power might be something you can access through mind as part of that primordial mind, or through the heart-mind connection, right? But that this is really a beautiful opportunity to explore many ways of looking at our connection with the universe that in that busy heyday before the COVID lockdown, we didn't have time to do. We were human doings, and now it's time to be a human being and work a little better on our connection with the universe. And also what you find is the hardships and difficulties are often provide a pathway towards growth. And I would say that in many ways, I see the COVID pandemic as a gift in disguise. It's what is in addiction studies often called the gift of desperation. And in many ways, it kind of forces us to kind of reassess why we're here in our connection with the universe. But I think many of us can open our minds and try and find some new purpose. I mean, if nothing else, then to help in, in a bread line, or in helping with all of this unemployment and food shortage. It's part of the lockdown. And part of having all these businesses shut down. We really need to take care of the least, the last, and the lost, which gives us a beautiful reason to live, and that's what we can really take advantage of in this kind of an environment.